Hello again. Now, Unicef says progress in preventing childbirth deaths has stalled since 2015. It blames this on a lack of investment in maternal and newborn health. Now, Sweden hopes to make a little dent in sexual and reproductive health and rights. It's investing $42 million in East and Southern Africa. Let's find out more about this from Unicef's Laurie Gulaid, joining us live, virtually, of course, from Nairobi, the Kenyan capital. Laurie, good afternoon. Welcome to Today. Thanks for joining us here on ENCA.
Good afternoon. Delighted to be here with you, Dan.
Yeah, you must be pleased as UNICEF because you are one of those agencies that are set to benefit from this injection of the $42 million by Sweden.
We are extremely excited about this really important and generous investment in the sexual and reproductive health and rights of all people in Eastern and Southern Africa. It's an important partnership, and we hope to translate it into really improved health outcomes.
What are you going to be trying to use it for? Where's the focus for you as UNICEF?
So, as you know, it's a joint program with UNFPA, WHO, and UNAIDS. And as you also know, UNICEF focuses on the youngest population. And in this program, we're really looking at adolescents, young people, and women. And we really hope to focus on building on what we did in the first phase of this program, because this actual second investment is bringing us to about 99 million over 8 years. And we're going to be looking at policies, not just to create new policies, but take the wonderful policies in this region and help them get domesticated and implemented. We're also looking at scaling up quality integrated services that don't just look at one disease, but bring it together for the person who's coming into the clinic. We're going to look at really following youth leadership, not leading the youth, but following the youth leadership. And finally, a new component is looking at SRHR, or sexual and reproductive health, in humanitarian settings.
Yeah, so you got a number of
One thing we will not do, Dan,
yeah.
One thing we will not do, Dan, is small, little, expensive boutique programs or programs that are cooked up outside the region and brought in. We're looking at local impact at scale.
Okay, that sounds sensible. You know, just the other day, there was a conference around HIV/AIDS in Durban here in South Africa, and yet again we were reminded that the prevalence of HIV/AIDS among the adolescents, especially in young people ages 15 to 24, remains very high in our country. I don't know what the rest of the region looks like, and how you think this would assist UNICEF's programs in the HIV/AIDS space.
So UNICEF has been working on HIV for a very long time, and there has been massive progress, not just in the region, but in South Africa itself. That said, you are absolutely right. In fact, 1 out of 5 new infections in this age group, adolescent girls 15 to 24, 1 out of 5 globally occur in South Africa. So South Africa is a huge priority for this issue. And we're at a stage in the epidemic where we really have to work on issues together. That is HIV, early and unintended pregnancy, and gender-based violence. And we will, in this program, really try to bring different issues together, like keeping girls in school, like shifting gender norms. And this is very much in line with a UN initiative referred to as Education Plus, which UNICEF helps to co-lead.
Yeah, I mean, $42 million from Sweden may sound like it's a lot of money. Yes, you are welcoming it, but I'm sure there's more needs, especially around issues of gender-based violence.
There are more needs for sure. And what we really hope to help governments to invest in these areas as well, and to keep increasing those investments. Gender-based violence, too, is another huge priority. On average, 1 out of 3 women in this region experience some form of gender-based violence, and the rates actually went up during COVID-19. We won't just look at survivors of gender-based violence, but also how do we prevent gender-based violence. And based on learning through the first phase of this program and other work we do as UNICEF, We know it takes a comprehensive package of services. We know we need to empower young women, and we need to work with influencers like community and religious leaders, and importantly, men and boys.
Yeah, I'm pleased you have to work across, not just focus on the girls. So now that you know that the money is coming, are you going to be, what happens next in this partnership? You've mentioned a number of other organizations that you need to do. What should be the next steps that you are taking as UNICEF with your partners who are now getting this funding?
So as I mentioned, it is a joint program and it is building on the first phase. So we expect a really smooth transition. And I'll just give you one example of a really exciting initiative called the United SRHR Movement. This started with a summit in Johannesburg. 100 young people came together to talk about how they could change the SRHR situation in this region. And they came from 14 different countries, and they worked on their advocacy messaging, how they can outreach and bring more people into the movement. And they really designed and led the entire meeting. And they're ready to take this forward, and we're ready to support them.
Yeah, you mentioned something very interesting earlier, Laurie. You're saying gone are the days where you're going to be coming in, or people coming in from outside with their own ideas. You're going to be looking locally, and you're also going to be looking for the young people to lead this in East and Southern Africa. What's been the response like when you engage with the various stakeholders around your approach?
It's fantastic. And it has to be an open dialogue because we all bring something to the table, but people want to be heard. People need space and voice and access. I mean, think of a problem you or I have. We know the most about what we need to solve that problem. And so I'd love to say those days are gone completely. I'm not sure they are, but we are working towards really localizing the solutions and bringing them to scale.
Thank you very much, Laurie Gulaid. Good luck with your programs. She's, of course, UNICEF's regional advisor for HIV/AIDS, based in Nairobi, in Kenya. Just reacting to the good news that Sweden is investing $42 million in East and Southern Africa for sexual and reproductive health and rights.